All right, so namaste from Mumbai, and we are going to discuss today about integrated homeopathic treatment, especially in IBS. And I feel that in a cosmopolitan city like Mumbai, like anywhere actually in today's times, with the kind of caffeine intake which is going on, with the kind of food habits and lifestyle that we have, IBS is one of the most commonest health issues in today's times. And really, integrated homeopathic treatment, which means homeopathy along with lifestyle changes, which also means certain changes in lifestyle, sleep patterns, what you eat, how you perceive life as, your mental state, your mental kind of makeup, your emotional state, your general state, how you sleep, how much time you sleep. Is it a kind of a specific time you sleep every day at this time and get up at that point? Is it a proper 7 to 8 hours sleep? Your metabolism. Are you working out? Are you having small wins every day? So all these would be very, very important factors in treating IBS. And I say this because almost in our setup, in our clinic in Mumbai, almost every day we are treating a case of IBS, and we are joined by one of our colleagues, Dr. Bhavika, who's extensively also working on nutrition and lifestyle changes for patients of different kind of categories and syndrome. And one of the commonest ones that especially we'll talk today is IBS. So welcome Bhavika to the talk today.
Good evening.
All right. And through the last decade, we have been treating some cases of IBS, and some of them really, really interesting cases. I can kind of remember some very, very interesting cases that I've treated with IBS. There was a case I was treating from northern part of India. It was a very complicated case of IBS along with eczema. And her main state, and very often this is one of the main commonest symptom of IBS, was a lot of nervousness, a lot of anxiety, constant feeling that, something is going to happen. And slightest stress, she would pass stools. This women about 50-year-old. And she would be very, very scared, very timid. She would get affected by the slightest of thing. She was also a very shy person and someone who wouldn't interact so much with other people. Many fears, claustrophobia. She was very affected by how people perceive her as. Smallest things would affect her. And also, she would feel very kind of forsaken, alone, lonely. On studying her case in depth, and I'm telling you this case offhand, on studying her case in depth, I found a very beautiful remedy, because she was treated before this by many other homeopaths and she was not improving actually. And I actually found a bowel nosure, that is that dysentery compound, which is actually a bowel nosure, which is prepared actually from one of the bacteria which is found in the gut. Very, very interesting. And some of the homeopaths who might have been watching this will know that I've written a book on bowel nosures, and sarcodes. It's called as Materia Medica of Nosures, Sarcodes and Bowel Nosures. And with help of dysentery compound, she really improved beautifully well. Many such experiences actually, with different remedies, with different patterns. Because what we do in homeopathy is actually something very, very basic, but very, very intriguing. Where in a case of IBS, we are not focused only about the stools, because we understand that the entire symptomatology of IBS, which is a lot of flatulence, gas, bloating, cramping, diarrhea, constipation, alternating diarrhea and constipation. We try to look at different areas of a person's life. We try to focus at different areas, their chief complaint, their stress levels, what happened just few months before the first symptoms of IBS came in, and their fears, their anxieties, their stressful situation, even dreams. Dreams can often be a window towards a subconscious state at a deeper level. So really understanding all these different aspects, along with their past history of illness, their childhood, even childhood traumas. Childhood traumas are so underrated, because what you are today is actually a result of all the experiences you had in your childhood. And that includes all of us, even me. When I look back at my life, and I do realize my own patterns as well, being a human, and I know that the patterns that I have at this moment, which may or may not be harmonious, have a lot to do with my childhood memories as well, childhood traumas as well, childhood not so pleasant experiences as well. So we also focus at childhood. So understanding all of this, along with even familial genetics, in the family, what has been different illnesses, what have been the pattern of illnesses, what have been the habitat. So understanding all of this, we try to study the person in detail, and then we analyze, and then we find a homeopathic ultra diluted dose that can actually help go in depth in a case of IBS and really heal within. So I do believe that homeopathy, along with lifestyle change, integrated treatment, is the way forward for different cases of IBS. And IBS is kind of psychosomatic in that way. More often than not, more cases which I have seen have a lot to do with their mind state. So Bhavika, you should share some of your kind of thoughts on some of your experience, and what are the changes you suggest for certain lifestyle changes that you suggest to patients with IBS. And we also have been joined by Dr. Srishti, who's also part of our nutrition clinic team, along with Bhavika. Go ahead, Bhavika.
No, sir, seeing the IBS cases, that we very well know that there is a lot of relationship between the mind and the gut health of a person, because they are, as we call the gut as a second brain of the human body. And what we have usually seen, I would like to share. I think I have previously also shared the same thing. That I had a patient of IBS, and she was like the role of the nutrition that was in that main role of that. So she was taking a lot of milk every time. So I told her to avoid the milk, and she was feeling much better after that. And the recent case of IBS, which I have been seeing, so he had to diagnose the patient very properly. So I was taking a follow-up, and she messaged me that I had a confession to make, because I told her to avoid that, don't eat that. So she was very nicely telling me that I am having a confession to make, that I had a pani puri yesterday. So so I was laughing, and I told her that it's absolutely okay that you had a pani puri. There is no if you are suffering from IBS, it is nothing like that you should be you should not eat pani puri. And the only thing I guided her was that you should not be feeling guilty or should be feeling very bad about anything. You should feel good about anything which you are eating. This is what you should eat, whatever you want, but you should feel good about what you are eating, and you should not feel guilty of having a pani puri. Like
I
I
think
know
this
you
is very
have.
common, no? Where in today's times with the Instagram world, and you
Yeah.
see different pictures, different body images of different people on Instagram and social media, and sometimes you have a craving about a particular thing, and you eat a little bit of it, and you go into a guilt, and actually that is more kind of disastrous. I think it's okay to eat whatever one wishes to. Probably the portions and the limitations of what you eat may actually be useful. So I think that's the idea, avoiding binge eating and just focusing on maybe trying to eat it in limitations. I think that will help. Srishti, some of your experiences, what do you suggest our cases, IBS, that we are treating in our kind of integrated homeopathic setup that we have here in Mumbai?
So, sir, what we basically see that like certain food items which have like lot of fermentable oligosaccharides, disaccharides, monosaccharides, which are like short chain carbohydrates. They are very poorly absorbed by our small intestine, and because of them, patient develop key symptoms of IBS like cramping, diarrhea, bloating, constipation, and all the symptoms. And IBS is again very individualistic disease, but because not everyone is sensitized to each of the food items. So in our clinic, when we do the nutrition consultation for the patient, and especially for the IBS, we tell them to avoid first of all the foods which are high in these fermentable starches and like dairy products, contain wheat products, vegetables, and we also tell them to maintain a food diary. So because of the we are able to identify that what the individual is more sensitive to. And following that, we restrict those items and then continue on. Because restricting the item for a long time can be challenging for patients as well. But when we see the patient in a better health, he's linked with our homeopathic medicine and movement, then gradually we try to reintroduce all those food items back in the diet so that patient is a bit resistant to sensitization with a repeating habit. So this is a pattern we follow. Try to case of IBS in a nutrition consultation. So it is a great importance to maintain a diary to identify the things that you are more sensitive to, the things that can trigger your symptoms.
I think very clearly in today's time, and even just today we saw a case of IBS as we speak. I think very clearly in today's times of this generation, I think one of the clearest things that we need to change in the patients, or even a lot of homeopaths who are actually watching our Instagram video right now, or even patients or their family, clearly some changes that you would want to do at minimalistic level. One of them will clearly be reducing caffeine, reducing tea and coffee to a bare minimum. Maybe 1 cup a day would be it would be something which is possible, and also that cup should come after having food. Do not have it empty stomach. So that's one of the first thing I will suggest. This I can tell you with some personal experience. The second thing that clearly should be changes along with caffeine is reducing milk. Reducing milk and milk product in your diet at least by 70 to 80% is something that which we highly recommend. Reducing meat and processed food will definitely also be, and especially here I'm talking about the frozen meats, is something that is totally you should remove it from your diet. And even if you want to have meat, it would probably you would want to look at organic places to kind of have it. And also in some cases you can also look at reducing gluten, because some people can have some sensitivity towards gluten. So these 4 or 5 things, along with a 20-minute of high intensity, or even some more kind of ideas about this going forward.
So, in spite of like the patients are getting help from homeopathy, and even the diet also plays a very major role. The other thing which I have noticed in the patients is like the cause. Many a times we have seen that the chronic stress, anxiety, a lot of fear. Like we know that whenever we have an exam, we have an interview, or like if we are waiting for some good news or bad news, we have a we tend to pass tools like that is we know many remedies in homeopathy also which we prescribe for that, like examination funk and everything. So what we have seen is there is a lot of relationship between the anxiety, stress. So we advise like we tend to manage stress also. So for that we advise patients for the meditation, or inculcating themselves for some kind of hobbies which they like, or to spend time in nature. These are the some different form of changes, and some pranayam, yogasans, or advising them to sit in vajrasan position after eating, and eating your food, like chewing your food properly, keeping yourself hydrated. These are the some few tips, like additional tips which we guide patients and which help them. And we tell them the importance of sleep, because many patients of IBS are not able to sleep properly because of the nerves are affected in the patient, so they are not able to sleep, and they have lot of weakness and fatigue. And because of lack of absorption and assimilation, patients suffer from the deficiencies of certain vitamins like vitamin B12 or iron deficiencies. So sometimes we also prescribe them supplements. And the role of prebiotics and probiotics in cases of IBS. we firstly try to maintain that with the natural form of probiotics. If it is not helping, then we can prescribe them also. So these are certain, and sometimes we also tend to advise them about the essential oils, which helps them to keep calmer. So managing stress is one of the very like major role, which like in cases of IBS. Yeah. So, sir, I would like to know from you what kind of major pattern you tend to observe in IBS cases or diseases like digestive disorders.
I think just like in any other case, I think it's very difficult to tell you that in IBS this is the pattern, you should give X remedy. That's exactly opposite to the philosophy of homeopathy. That I have even given some very not so very common remedies. Even a remedy like Baraita Kawa I have given in IBS actually with very beautiful results. You still in that case have to kind of, even if that patient has nervous diarrhea, IBS patient, you still have to go in depth, try to understand the patterns of the patient at different levels, a little bit more importance on the psychological state and the childhood and early childhood and a later childhood, and understanding where does all these patterns actually arise from, their experiences during that time. And I think based on that you want to individualize. I think very important would be childhood and emotional exciting factors that may have affected the person. I think that would be very important, and be open to understanding this experience of the patient. Like I told you, the remedies which we have used for IBS have been very vivid and very diverse, and there is actually no kind of clear specific for IBS in that way, because that itself is the main thing about IBS. IBS is a psychosomatic illness, so you want to individualize the person and their state.
So, yes, I think, sir, we have covered our main points. So, just to conclude, like, first of all, they should not skip daily meals. They should not eat it too much, which are the general basic rules we ask all our patients to follow. And to avoid for certain foods which have triggering factors, lot of spicy and fatty acids food, and to avoid alcohol, caffeine, and tobacco is a big thing that can really bring about positive changes. And also more of fresh food, home cooked food, fruits and salads plentiful in their diet can really help. And along with exercise, which can help in their metabolism as well as reduce their stress. So these are the points that we want our patients
Maybe we
to.
can take some questions from our participants who are watching at this moment. Any that you can probably see.
If anyone have any question, you can drop in the comment section. We'll just take few questions.
Also, educating the patient can help a lot, I do believe. Educating the patient about their own state can help a lot in IBS, because making them aware where actually everything is coming from can really help a lot, along with giving the remedy. So I think it plays a very important role.
There's a
So I think there is
question.
one.
Yes, by Pushpa Salvadi. She asks, does IBS have any relation to autoimmune thyroid?
Not directly, but you should know that IBS, which is a psychosomatic kind of disorder, and autoimmune thyroid, which also autoimmune illnesses, all of them always have a component to do with state of mind, a component to do with lifestyle, a component to do with eating habits, a component to do with sleep patterns. So somewhere you can definitely call it as different disorders, definitely clinically you can categorize them, but at a deeper level actually the changes that one has to make is central, is core to the person. And that's where actually homeopathy is so holistic kind of treatment, that even a patient who has IBS and autoimmune thyroid together in a case, you still require one remedy to prescribe. This is so beautiful about our science, and that's why at our center here in Mumbai, at the homeopathic center here in Mumbai, in Mahim, where we are practicing, and anyone who has IBS or has knows anyone who has IBS who wants to take treatment or any other illnesses, you can write to us on the contact details which our team will set up. You can just drop in an email or DM us to take a consultation, either in person or even online across the globe. I do believe that the right homeopathic treatment with certain changes in a person's life, lifestyle changes, I think can really make an impact, especially in this illness more than anything else. Any other thought, any other question from our some of our friends?
So there's a question, is there any relationship of IBS and intestinal flora?
Always, always, always. Intestinal flora will always make a difference in IBS. So many patients who have just in initiation IBS, they might take a lot of antibiotics or they might take many anti-parasitic kind of medicines from the allopathic doctor, and it will actually aggravate the IBS symptoms. So having a healthy intestinal flora will always help. Absolutely, and that's where I remember this statement from Dr. Vijaykar, and he had said this, that homeopathy is one of the only science which accentuates the healing in a natural way. So it almost, in a way, it kind of accentuates, it supports Mother Nature to heal. So it's a very interesting kind of line of treating, where you actually make some natural changes and look at naturally trying to heal. And that's what I kind of strongly feel, along with our team here, Dr. Srishti and Bhavika, and we in our setup here are here to help patients. If you want any of our help, please write to us. We have our email ID, which I'm going to just type it for you very quickly. And there are some people who are written as a request to join. Maybe I don't know how to do that, but I'll try. Okay. There is one more question actually.
Yes, sir. So there's a question. So that we ask about the childhood to understand the issue at a deeper level. But she wants to know that how do we get back to the normal state after opening our book, because I think of someone who overthinks.
Yeah, I think that's what homeopathy can do. Homeopathy, the case taking in homeopathy itself is very cathartic. It causes a catharsis. It makes you kind of relive those wounds and also gives you a healing touch there. And I think the main thing is the role of homeopathic remedy, because it really goes at deeper level and heals within. I think once you start the remedy, automatically you will see some beautiful changes. I think the taste of the pudding is in trying it. I think that's about it from us today, and maybe we'll come up next week on Monday with another topic with Dr. Srishti and Dr. Bhavika. Any last words from both of you?
So, concluding this session, I will just ask all our viewers to follow our account, which is Integrative Homeopathic Clinic, where we share all these nutrition tips and a role of homeopathy, nutrition and movement in managing various disorders. And if you have any queries or any suggestions, you can write to us, you can DM us. And if you know someone who might need a consultation still, you can email us and we will try our best to help you with our integrated approach.
That's about it. Thank you. See you later.